Okay, so welcome to part 6, menopause and weight gain. One of the biggest things that we hear with women's healthcare, why we gain weight in menopause and what are the things we can do about it. Okay, so clearly there is this metabolic shift that happens in midlife. There's a 25% reduction in metabolism, and that's associated with getting older. Our metabolism just doesn't work as properly, it's not moving as quickly. And then there's this shift into what's called this central adiposity, which is more of that mid abdominal belly fat and weight gain. Most women on average are going to gain right around that 5 to 10 pounds where they come in and they say, you know what, I can look at food and gain weight. Is that something pretty common that you're all hearing? Yes, 20% of women will gain weight during this transition. And just being armed with why it's going on is a lot of what this video series for this chapter is going to be about. So why do we gain weight in midlife? It's really multifactorial. It's not just about willpower or about lifestyle. There's a decline in estrogen. You've heard me say that estrogen is an anti-inflammatory hormone, and it really helps a lot of things that are going on in our body. So there's this energy dysregulation, there's these external variables, and there's the hormones. So when the estrogen declines with the relative rise in circulating testosterone, that kind of shifts this fat distribution. Instead of hips and thighs, fat becomes more in that belly, abdomen, and it leads to that visceral fat or the belly fat. And that is a much more metabolically active and riskier fat that happens, and it puts us more at risk for health conditions. There's also a natural reduction in the total energy expenditure as we age. Cells don't signal energy use very efficiently during this time, so women burn less fat with the same amount of effort. Muscle mass and strength decline, that's by about 3 to 8% per decade after the 30s, and there's a further slowing in this metabolism. You also have genetics. They influence the body composition and the fat storage patterns. And then there's these indirect causes. Sleep disturbances. Sleep is so huge. Most midlife women are having sleep disturbances. Either they're waking up hot, they're stressed, they're anxiety, and it's often due to night sweats or insomnia during this perimenopausal shift. When you're not sleeping well, it disrupts this insulin sensitivity and it leads to more carbohydrate cravings and weight gain. Stress also increases your cortisol, and that promotes central fat accumulation. There could be some thyroid dysfunction that's going on, or side effects from medication can contribute to that as well. When we look at this diagram, it highlights those 3 interconnected dividers: hormones, your estrogen, your testosterone, your progesterone, your thyroid, all these shifts. There's this energy dysregulation with that slower metabolism, less muscle building. And then again, those external influences, the sleep, the stress, the lifestyle, and the meds. So midlife weight gain, it's not inevitable, but understanding kind of the biology around it really helps women approach it with science-based strategies instead of guilt and blame. So this perfect storm is happening during this time. You get those decline in hormones, and that increases the inflammatory markers. Very common to see shifts in homocysteine levels, C-reactive protein, increases in cholesterol. Some patients even have some mild hypertension that happens during this time because estrogen acts as very much an anti-inflammatory type of hormone, keeping things in a check and balance. So that chronic inflammation leads to this insulin resistance, decreased ability of its body to repair itself properly, as well as some metabolic changes, more fatty liver disease, metabolic syndrome, and things of that nature. So what can we do to help this? So really important. Number one, I'm always going to say support your sleep. We have a whole entire chapter on sleep where we talk about what sleep regulation looks like, good sleep hygiene, and I'll direct you over to that. We also want to make sure that we're building muscles and we're meeting our protein goals. We talk a lot about that in lifestyle and nutrition. Heavy lifting, starting off on smaller, more frequent exercising is great, and then adding in stronger weights as you get more comfortable. You also want to prioritize your gut health and your fiber. Again, I talk about this in the lifestyle portion. 35 grams a day of fiber goals is really important. It helps with that visceral fat, that fat that surrounds the organ tissue, the organ tissues leading to cardiovascular disease. You also want to cut out a lot of the processed foods and alcohol, and then calming that stress response. And we talk a lot about that in that lifestyle video. Exercise, really important. Cardio is great, but I like you to stay in zone 2, especially in midlife, where you're still able to be conversational, not getting that heart rate spike too high like HIIT. HIIT is fine, but it also is really taxing on our body. It can be really taxing on our adrenals, shooting up that cortisol, especially if weight gain becomes an issue. So with HIIT, I say no more than 1 to 2 times a week if you're going to do cardio in that lower zone 2. Strength training really improves insulin resistance. It boosts that metabolic rate, and it really also improves the body composition. Interval training things are going to be really important. It decreases that waist hip circumference. It improves BMI. Core is also really important. Pilates, posture, all those things. If weight and exercising are difficult for you, you can also do a lot of walking. We talk a lot about in lifestyle too, about just using weighted vests and where those make a difference as well too. When we're doing strength training until muscle failure, that is really important for myogenesis. You need to be doing this 2 to 3 times a week for 20 to 30 minutes. You want to lift heavy, but you want to work up to that. So prioritize those big lifts like your deadlifts, your squats, your lunges, and things of that nature. 3 to 5 sets with 6 or fewer reps. And remember, form is super, super important. So if you're new to strength training, just work your way up to it nice and gently. In terms of your nutrition, again, you've heard me talk about having a very colorful plate, fruits, vegetables, kind of when you go to the grocery store, stay in that outer aisles, which is going to be your produce, your things that are more natural. The intersections of the grocery store tend to be more of the processed foods, box foods, lots of preservatives. You really want to be focusing on adding in an abundance of just different things with healthy diet and lifestyle. And then if things are not working for you, you can also consider working with a registered dietitian along with your healthcare provider. Protein, again, is supposed to be really prioritized. We talk about that in the lifestyle video. You want to make sure you're getting about 30 grams per meal, 3 meals a day, or right around your equivalent in body weight. Again, that's hard for a lot of women to get that in, so easing into it is great. And then that 25 to 35 grams of fiber a day to help with that visceral fat. In terms of tips and tricks, make meal plans, set goals. You can set short and long-term goals, but I also say it's okay to indulge every once in a while. You don't want to tell yourself no for everything in the food category because that's just going to make you want it more. Exercise is important. Ease into it slowly and gradually. In terms of your movement, you can have movement snacks, movement after meals, eat properly. Intermittent fasting can be great for some people. And I usually try to say eat by 10, even if you're intermittent fasting, because sometimes when you're intermittent fasting in this midlife, it's really hard to get all of your proteins in. So that's important. You want to kind of have maybe that 10 to 12 hour window of eating, high fiber, colorful plate, your protein, no liquid calories, make sure you're staying hydrated, lots of good fats, and again, really, really prioritizing your sleep. I like to put this article in here because one of the most powerful and simple things that often gets overlooked is just moving after meals. A study highlighted by CNN in 2023, along with a systematic review and a meta-analysis, showed that as little as 2 minutes of light walking after eating can actually lower blood sugar and improve that cardiometabolic health. This matters especially in midlife when metabolism really starts to slow down, that insulin resistance increases, and weight management becomes a lot harder. Any movement is better than no movement at all. Even short, light intensity activity makes a lot of measurable differences. For patients who feel overwhelmed by the idea of normal exercise, you don't need to start with a 5K or a gym membership. Just simple, consistent habits like walking after dinner or breaking up long periods of sitting are really effective. It's really important to build movement into daily life. So maybe walking around during phone calls or parking farther away or standing up every 30 to 60 minutes. These are small, sustainable changes, but guess what? They really add up. This whole idea of movement doesn't need to be intimidating. Just remember, it needs to be consistent. Also, there's some growing research on time-restricted eating, or what we call intermittent fasting, especially midlife and beyond. They don't just influence weight, but they also affect that metabolic and hormonal health. Findings from some of the recent studies have showed that there can be drops in some insulin levels with this intermittent fasting, and that can sometimes improve that insulin sensitivity and lowering the risk of metabolic syndrome and type 2 diabetes. There's also it's also associated with a decline in those inflammatory markers. And I think that's really important, since these chronic low-grade inflammation really increase with age, and it's really linked to cardiometabolic disease. Studies also show some improvements in hunger and satiety, and with the hormones, that people feel more satisfied and they reduce that overeating and cravings. In those pre- and postmenopausal women, the research suggests that intermittent fasting can potentially even influence sex hormones, although we need a lot more data to really understand its impact on estrogen, progesterone, kind of really during this midlife transition. Intermittent fasting, though, I just want to say, is not for everybody. Those with a history of eating disorders, medical conditions, or on glucose-lowering medications, it really needs to be individualized and nuanced. So just again, structured meal timing may be important for you, and even small adjustments like limiting your eating to like that 10 to 12 hour window, that could potentially improve some metabolic health. So hormone therapy and menopause. I'm never going to say that hormone therapy is going to totally help you lose weight, but women tend to gain less weight in menopause when they're on hormone therapy, when they're done with the right dose, the right formulation, because estrogen really does improve insulin sensitivity and mitochondrial function. Progesterone helps sleep and that stress response. And as you know, those two pieces really interplay with that weight gain. And then testosterone really helps with muscle growth and optimizing that as well. In terms of just kind of the importance of estrogen for body weight, again, in the KEEPS trials, the BMI increased significantly less in women that were on menopause hormone therapy rather than on a placebo. Estrogen, again, you keep hearing me say it's this anti-inflammatory hormone, and it really regulates body weight by decreasing that appetite and increasing feelings of satiety. It controls kind of by acting on that hypothalamic nuclei, and it really kind of interacts peripherally with certain type of peptides. And that's why a lot of times kind of working it synergistically with GLPs, which I'm going to talk about on the next slide, can be often really a good option. So in terms of weight management options, there actually is some really good data that's been published on menopause hormone therapy and also the use of GLP peptides, and that patients tend to do better on the GLPs when their hormones are optimized. There's a lot of anti-obesity medications, orlistat, phentermine, Qsymia, Contrave. The GLPs are phenomenal. Unfortunately, GLPs can be really, really cost restrictive for patients, so other options are out there. And there are other options that include surgeries, hypnosis, mindfulness. I'm finding that there are less people getting surgeries with the advent of the GLPs. So the hope is that insurance does have some regulations around it, and that we can see some better results with getting people on GLPs because they work so well synergistically together. There are some supplements that you can do for weight gain. They all work by kind of balancing out that gut microbiome. You're going to see much slower weight loss with it as opposed to a GLP, but some of them work well for some. Things could be things such as turmeric or omega-3s, berberine, inositol, vitamin D, chromium, probiotics, and I'm just kind of going to leave those there as options that you can look at. But again, talk to us here or to your healthcare provider if this is something that you are thinking about for just long term for doing menopause and wanting to get on a GLP. Okay, so we're moving right along. Next up, we're going to spend some time going over what sleep goes on during this time frame and how we can develop some really good sleep hygiene.